Hello and welcome back to Silvia's Health Hints. Today I have a little bit of different thing to talk about. It's not about health system in Italy. It's a little bit a different video. But when I was my short vacations, the vacations I'm always talking about, I was thinking a little bit about my patients, me and my patients, my relationship with my patients, maybe because I was a little bit missing my patients. It happened also last summer. I have a lot of students and professors from the university here in Florence who are my patients, and normally the period of August in summer they all go back to their home country, so I don't see them for a longer time. And then I start to miss them. When they come, and they are so many, sometimes they are too many, but when they are, when we don't see each other, I sometimes miss them. And I was thinking a little bit about the relationship between doctor and patient. How it should be, how is my relationship with my patients. I was thinking a lot about this. And I wanted to share these thoughts a little bit with you, with my patients if they watch my videos, I hope. If not, you cannot come back. No, I'm kidding. With most of my patients I have some kind of friendship or even almost family relationship. I know them very, very well. I think that this is important to know something about to know the background of the patient, because I think that in this way you can help better with the health problems. Because illness is not only about physical infirmity, it's also about mental health, emotions. It's determined also by social, professional and private life of the patient. So you need to understand the whole person and know the whole background. It's also good to know, for the doctor to know the patients well and to see them not as only patients or even clients, which is, I really hate this word in connection with doctor and patient, to see in them a little bit more than patients and work. This could be a good motivation at work and helpful, for example, when you need to be for them also outside your working hours, which is easier to do it for a friend, for someone who care about, than for only a client. It's also, my patients know me also very well, which is, especially in my case, I think very good, because they can accept me better as a human being who sometimes has a bad day, is tired or angry, and to not take it personally, because very often it has nothing to do with the person who comes, with the patient who has the appointment. Sometimes it's all other things that makes me angry and that makes me maybe behave a little bit different. But my patients know me very well, and they never get offended, they never take it personally, they know that this is something else, maybe my birds or something like this. Okay, I think I was thinking also about how the cooperation should be. I think that there must be a cooperative and equal relationship between patients and doctors. I believe that a doctor is only as good as how to say, as the patient is collaborating with him, is helping him. I think that without the collaboration, without the help of the patient, the doctor is not able to judge really good his health conditions and to help him. It's not only about being updating, about the knowledge, the science and all this. It's really also, I think that without the help of the patient, it's impossible to make a good diagnosis and to judge the health conditions. And this is another point, we arrive to another point, that this requires that the patient also is emancipated and responsible. That the patient doesn't give the responsibility to the doctor, says, I had a case, I remember, the patient came to me and I asked, how are you? And the patient answered, this is something I want to know from you, you are the doctor. And I said, no, I don't know how you are, I can tell you how I am, but you need to tell me. So also to know yourself and to trust yourself, to trust sometimes maybe a doctor, me including, we can also misinterpret something. So a patient can correct us. I see that you understood it in this way or that way, but you know, it's different. It's not what I said. I mean something different. To have the courage to say, no, I think, doctor, you are wrong. This responsibility for ourselves, I think this is something really important. A doctor should also understand the fears of the patient and absolutely respect his will. I think that at the end, the doctor's work is not to influence the patient or even manipulate him, maybe even using, scaring the patient, you know. We have a lot of power as doctors. People see in the doctor some important person, some person who knows so much things, and people trust the doctor. So it's very easy, maybe even not because you want it, but because it happens. It's very easy to, how to say, maybe it's a little bit a strong word, but to abuse this power we have and finish to influence or even to manipulate a patient, which shouldn't be. Respect the will of a patient. I think it should be really something like number one, a rule, one of the most important rules, because at the end it should always be the patient who decides. There are only few cases, because maybe there's some colleague who sees now the video and doesn't agree with me absolutely and says, what is she saying? We have the responsibility, we need to decide, the patient doesn't know. I mean, we remember very well a period, very recent, that these things happened, and I think we should really don't treat patients as, now it's also a little bit difficult, like children is not a nice word to say now, children, because we should also respect the children. For example, when I have a lot of, maybe 30% of my patients are pediatric patients, and even if the child, even if we think that maybe the child doesn't understand or is not able to, to decide, we should always ask the child and always search the collaboration and not just do. I think that it's very important to respect the will of the patient, and that the patient should be free and decide. And to come back to this point with the colleagues who maybe don't agree, of course there are few cases, but really few cases, in which the patient is in danger to life or a danger for other persons, that permit that the doctor decides for the patient. But these are really extreme cases in psychiatry, for example, and not the daily work of the doctor. The doctor should not only accept and respect the will of the patient, but also shouldn't judge the patient's opinions and decisions. Even if the patient undertakes a different way as we recommend, or a doctor recommends, the doctor's work is to be open and say, okay, even if then to help him on his way he choose, and also that the door is still open even if there are consequences of this decision. Maybe the decision was wrong from our point of view, but at the end we don't know if it was right from his point of view. So these were a little bit the thoughts about the relationship between patient and doctor, how it changed over the decades, how it was in the older medicine, how it changed also during the pandemic, for example, and how it will be in the future, how things will develop. I hope that my patients and all patients will be responsible for themselves, will be aware of this responsibility, and I hope, especially for my patients, but for all patients, that they always will doubt and make questions, especially the uncomfortable ones, the questions the doctor doesn't like, the questions which are not easy to answer. And then there was another thing, another thought. It's not only a doctor should always try to imagine how it would be when I would be on the other side of the table, or if I would be the one who's lying on the bed. And seeing the patients a little bit like friends or family members, someone could say that it's not professional because you don't have the correct distance. But on the other hand, I think it has also some positive sides, because a doctor should always remember, never do to your patients what you don't want to do to yourself or to your family. I think that sometimes in medicine this is forgotten, but I think it's a really important thing. So today it was not about being expat patient or abroad student patient or foreign patient in Italy. It was a little bit, maybe a little bit chaotic, but sharing some thoughts with you who are watching these videos and who are my patients, maybe with everybody. Thank you for watching this video and see you the next time. Thank you.